Welcome back to ECCMID TV, where we've just been through the session of a year in clinical microbiology, chaired expertly by both Niels Frimodt-Moller and Emilia Cercenado. Let's welcome them both to the show and ask you, first and foremost, Emilia, from your perspective, you really enjoyed chairing the event, I could see that. What were the key highlights of it for you?
I really enjoyed this chairing this meeting, because in Spain I am in charge of doing this kind of update every year at the Spanish Society of Clinical Microbiology, and I enjoy chairing the meeting and waiting about what these professors waiting about their point of view about the different topics that they have included in their talks. So I enjoy very much the meeting because they have performed a very good update on pathogenicity of the bacteria, on susceptibility testing, new methods for susceptibility testing, and also on the new methods in clinical microbiology. So this was a very nice update and a very complete update. They didn't have enough time to cover all the aspects because everything is new this year in microbiology, but the summary was excellent.
It was certainly fascinating. Turning to you, Niels, if I may. New technologies, sir, are giving us a deeper, more meaningful understanding of the world of the bacterium. What did you take away most, though, from the actual update on clinical microbiology itself?
Well, actually, I think that it was interesting that although we are moving ahead with genetics, all these molecular biological methods, it was interesting to see that the old-fashioned methods with culture are still there to be developed and also to use. There were several talks about using blood culture bottles for specific infections, not looking at bacteremia but other infections. We also saw new media being developed, which can actually be used for both anaerobes and aerobes and so on. So I think it's very interesting that we are still there to use the old methods while we are developing the new methods. I thought that was very interesting.
But overall, a very solid 2-hour update. Are you happy with it from a chair's perspective, sir?
It's a session that I will always attend myself at any ECCMID, so it was very interesting to be chairing the session, and you could see that the whole hall was filled during the whole 2 hours, so it's a very nice endeavor.
We've certainly seen outstanding turnouts for all of the sessions, and this one in particular, as you say, was very well attended. Emilia, as a final question to yourself, one of the speakers in the update talked of the European Antibiotics Awareness Day. How important is that in your world?
Yeah, this is very important. In fact, in Spain, where I work, we make this day, we make many presentations in different societies in Spain, in different hospitals. It's very important because we have a real problem of the resistant to many antimicrobials. We have very few options for treating infection, so it's very good to say to the people in general in the world, on TV, on general TV, to say that we don't have antibiotics, and if we don't have antibiotics, we have to use the ones that we have with a lot of caution, because otherwise we will get rid of antibiotics and we'll be back to the times of Fleming.
Awesome. Thank you both very much as well for your outstanding chairmanship. A real pleasure to watch the session. Thank you both.
Thank you to you for asking us.